Good afternoon, everybody, and welcome to today's webinar. Speaking to you all today is going to be Kim Olszewski, a nurse practitioner in occupational health for over 30 years, and DISA's Director of Client and Medical Provider Services. A few housekeeping items before we get started today. All attendees will be receiving a copy of today's presentation slides and the recording of the webinar. If you have any questions during the presentation, you may submit your question in the comment section, and we will follow up with all questions submitted after the webinar. If by chance we do not get to answer your question on the live webinar, we will be reaching out individually. There will also be a short survey at the end if you could just let us know how we did today. And with that, let me introduce you to Kim.
Thank you, Mackenzie, and welcome everybody. Thank you for attending this presentation this afternoon. As promised, I'm going to be delivering some statistics and resources and some information that hopefully you'll find helpful in your practices wherever you might be fighting this pandemic and getting past this pandemic and getting back to work. So we're going to start with looking at the objectives. So within the next 45 minutes or so, we're going to be looking at statistics and trends that are related to COVID testing, return to works, vaccinations, management of COVID, what we're going to call long haul symptoms. We're going to talk about total worker health. We're going to talk about some tools and resources and best practices, specifically during the times of COVID and what might be helpful to you and your organizations. And then finally, we're going to look at some virtual meetings and social media platforms and different tools that are out there for those of us that are working, maybe hybrid or in a home setting or a different type of setting, and some resources that might be helpful to you in your organizations as well. So we're going to start out with some statistics. Obviously, as you know, these statistics change by the hour, but these statistics were pulled actually on July 5th when I pulled them. It's from a site called Worldometer, World O-M-E-T-E-R, and it actually does live feeds of the updated COVID statistics where we are globally to where we are domestically here in the US. So if you look there, I have the statistics listed in black, where we are globally to compare to where we are here in the US at this time with COVID cases. So you can see there pretty astounding numbers when we look at been fighting this pandemic now about 18 months. And you can see that, here in the US, we had a substantial amount of COVID cases at 35 million. And actually, it just continues to grow, unfortunately. And we're going to talk a little bit about how it's growing now, specifically with these variants that are out there. So again, if you need to look at statistics and see where things are, that's a great site. There's multiple sites out there, but this is a live feed as to where we are, again, globally compared to where we are domestically. So I guess if you've been, when you get asked the question, have you been vaccinated? Probably the second question you get is, which vaccine did you get? I can speak to that here. We get a lot of questions about in the practice, were you vaccinated, or what type of vaccine did you get? And what's your thoughts? What's the best vaccine out there? Well, the data is still out. And as you know, we kind of moved that process along pretty rapidly to get these three approved that we currently have available to us in the US. And Yale Medicine just published an article beginning of the month here on July 1st, which actually did a really nice simplified comparison of all the vaccines. And I summarized that here for you now. And you can see here the three that are currently approved are Pfizer, Moderna, and Johnson & Johnson. All three are a little bit different, and they have a little bit different statistics. So you can see here, Pfizer and Moderna are the two doses, one of which is 21 days, apart. The other one is a 28-day separation between the two doses. And you can see the age recommendations as we start vaccinating our teenagers and some of our younger population. You can see there what the recommendations are as far as effectiveness for the three vaccines. So there's two additional vaccines that are being used outside of the US that we may see come here at some point, one of which is from Oxford AstraZeneca, which is a 2-dose vaccine, 12 weeks apart, and it has very promising data according to the literature against the variants that are out there. Novavax is another one that looks to be very promising. Actually, early studies are showing 93 to 100% protection against variants, which again is really of interest right now. And if you've been following the news, the Delta variant is the most recent concern. And the Delta variant is now the most dominant strain and what the World Health Organization declared back in May, a variant of concern. And they use this designation when there's an increased evidence that a variant is going to be more transmissible, causes more severe illness, or reduces the effectiveness of the vaccine that's out there and available. So the statistics that are most recent as of July 3rd, so just late last week, the Delta variant accounted for about 51.7% of new COVID cases that have been what we call genetically sequenced in the country, so what was detected here in the US. And comparing that to just 2 weeks earlier, back in June, that variant only accounted for 30% of new cases. So the Delta variant seems to be the one to watch right now. And you can see here from the 3 vaccines, if you get asked the question, is my vaccine, protecting me against these different variants, you can see, again, the statistics and the studies are still out, but you can see that there's a large percentage of effectiveness against these variants right now with the 3 different pharmaceutical companies that have approved vaccines out on the market. These are some just nice graphs. I'm a visual person. I like to put graphs up there so I can quickly see what's going on and what is, the most pressing statistics out there. And this data was also available as of July 1. Again, it just keeps updating and changing, obviously, by the day. But this is on the CDC COVID vaccine tracker. This is the website that I use for this data. And as of July 1st, there was 155, just about 156 million Americans that have been fully vaccinated. And fully vaccinated means that they've completed the recommended dosage for that particular vaccine. So for Pfizer and Moderna, that means they've had the 2 vaccines, and for Johnson & Johnson, obviously, it was just the 1. So 47% of the country's population was considered fully vaccinated, according to the CDC as of July 1. So if you're interested in how your state's doing, because I know we have participants here from all across the country, you can actually go to the CDC website and see exactly how your state is performing against national statistics. So at the time of me preparing this particular presentation, which I waited till, very close to when we were going to do this presentation so I could give you the most up-to-date data, Mississippi was considered the lowest vaccination rate as a state at 46%, followed by most of the other southern states were at or below 60%. So there seems to be the opportunity right now for increasing those vaccination rates. As of July 1, the state with the highest vaccination rate was Vermont, followed very closely by other New England states such as Massachusetts, Maine, Connecticut, and Rhode Island. Now, we're going to talk about this next, but you'll see on this first, up here in the first top left corner, it talks about administered vaccine. The second one there on the right talks about delivered vaccine. And then the bottom one there is fully vaccinated. So you'll see the terms administered and delivered. And you'll see on this slide here, which is another slide from the CDC, on the top left corner, those words are up there again. And just so we're clear on what that means is vaccine delivery or delivered means that the vaccine has arrived to the destination it was intended to go to. And administered means that they've received the vaccine. In other words, the person or the population that it was intended for has actually received that vaccine. So when you look at those numbers, you can see the difference between those two. And there's still lots of vaccine available. Should you or know someone who wants to get vaccinated, there's certainly lots out there for them to take advantage of. So just some numbers to really kind of, keep in front of you to see where we are as a nation statistically. This site will also break down the numbers by state, by population within the state. So again, if you're looking for data to see how specifically your particular state or a customer that you're working with in a particular state compares to the national average, you can pull this up at any given time and see exactly, again, where we are as a nation, where we are as a state, where we are globally with vaccinations. So there's a term called vaccine hesitancy. And the World Health Organization actually defines vaccine hesitancy as a delay in acceptance or refusal of safe vaccines despite the availability of vaccine services. So it's multifactorial. There's many reasons cited by the World Health Organization, everything from, issues such as complacency, convenience, confidence, and even socio-demographic issues. So when we see that term hesitancy, that means that there is some reason that a potential recipient perhaps is not interested or is reluctant to get that particular vaccine. So there's many reasons cited, and if you look here on the slide that I provided, I'm sure you've heard of them. I'm sure you heard of them in the media. I'm sure you've heard of them just in the context of conversation, working with, even with family members on why or why not they would not want to get the vaccine. So there's, these reasons cited, again, came from various resources, but one of which is lack of confidence in the vaccine. I think we've all heard many people say they were concerned that maybe the vaccine was released a little quickly, and there may be some concern on how effective that vaccine might be. There was concern about side effects and long-term effects. There was a lot of unknowns. And as the vaccine started back in December, and actually I was one of the people that got, the first week it was offered, I was first in line to get one of those vaccines. And remember when I said, which vaccine did you get? I got Pfizer, and that was the vaccine that I got. But there was concern about what were the side effects and long-term effects of these vaccines. We still didn't know a lot. There was concern again about that speed of approval and the development. Was it effective? Was it right? Was it done right? There was conspiracy theories out there. Was this vaccine altering DNA? Was there concern about fertility and breastfeeding and all of that went along? Was there concern about a trust in, perhaps the vaccine manufacturer and the government? And so there was a trust issue. And lastly, it was accessibility. When they first rolled out, everybody was talking about what tier are you in? When are you going to be offered the vaccine? If and when I get it, I don't know where to get it. I don't have transportation to get it. So just a variety of reasons. And the statistics show that there was higher vaccine hesitancy among women, especially if we look at women were 21% more reluctant to men who were at 15% more reluctant, and the younger age groups. Again, that might be parallel to some of those concerns about fertility and altering DNA. But from the age group of 25 to 34, there was about a 28% hesitancy. And then in the 55 to 64 year age group, there was about a 14% hesitancy. They also determined that people with a lower educational level, 24% in secondary school graduates and 13% in university graduates. There was also, an increased kind of focus on that hesitancy in that age group as well. So how can we kind of get past some of these myths and dispel some of the rumors and move people towards getting these vaccines? Certainly, we want to offer communication from trusted sources. CDC is really the trusted resource for information, and get that information out and into the communities, into your workforces, into places where people congregate to get good information out and dispel some of the rumors. We want to improve access to vaccine. So if it's truly an access issue, we want to think about delivery models. We've seen them being done in sports arenas. We've seen them being done through universities. We've seen them being done in all kinds of different venues. So think about how you can get outreach to your communities and your workers, or setting them up at your work site. That's another great option as well. We want to get the community engaged. Again, they need to be the champions out there. I know recently I heard just this week in the evening news, there was discussion about a door-to-door campaign. I believe the Biden administration was talking about something about a door-to-door campaign. Certainly there's pluses and minuses to doing that, but again, they're being creative, looking for ways to engage the community and increase the vaccine rate to get what we call that herd immunity. Finally, again, is when you're doing training and education materials, please be mindful of the educational kind of level of the people that you're trying to address. You want to keep it at a very simplified level with statistics that they can understand. And you want to make sure that the educational information is available in multiple languages. Should you have a community that has different languages and different cultures, you want to make sure that you are giving them the appropriate information in a language that they can understand. So finally, I want to talk just a minute about COVID long haulers. And you probably heard this term. Long haulers are those people that have these persistent symptoms after having COVID that seem to kind of linger. And it's estimated that about 35 to 54% of the people that come that had an acute episode of COVID, so we'll say, will have probably some of these long hauler symptoms for anywhere up to 2 to 4 months. And 50 to 76% of people reported that they had some new symptoms after that acute illness resolved, and they had symptoms that reappeared. So again, some of these can be pretty severe. About 9% of them can be some long-term severe issues. And these symptoms have been reported out as really pronounced or increased fatigue. There's been sensory deficits. You've heard people talk about the loss of smell and the loss of taste. Some of those have been, detected for many months after they've had COVID. My mom, for example, my mom had, and dad both had what we'll say mild COVID back in January. My mom still cannot taste or smell 5 months later. So again, prolonged symptoms that they don't quite understand why. Brain fog, headaches, dizziness, respiratory issues such as coughing and shortness of breath, and even myalgias and joint pain. So you can see here that, these symptoms, again, can be pretty impactful when it comes to putting workers back into the workforce, depending on the demand of job that you have them do. And we need to look at these long haul symptoms because at some point, ADA and FMLA may have some implications in returning these workers back to work. So just keep that in mind because some of these symptoms can last up to 8 months or longer. So what I recommend is that you evaluate your accommodations and you consider, if possible, that work from home option. That's a good option for allowing them to have that kind of work. I don't want to say work relax, but if they need to take a break, they can control that balance a bit. And you may need to think about if with, kind of that brain fog and some of the other issues that go along from a mental standpoint, retraining. So think about that as you return these people that are coming back from COVID on some of these, what we call long haul symptoms. So my recommendation is keep your policies up to date. Know what referral sources that you have, maybe an EAP would be helpful. And even some individualized support if they do not have like a primary care physician or any resources within the community that you feel that would be helpful, keep them close by that you can refer these people to that. Some things that, excuse me, I will have you consider in your workplace as a safety and health concern is, respirator use. We've been talking a lot about wearing masks, wearing, the N95s, wearing respirators. But think about that when they have to return to work and that be part of their job. If they're having issues with breathing, you want to make sure you get them evaluated before they put them back into a respirator. And from a safety concern, you also want to think about if they have a deficit of smell and taste, if part of their job is to detect an odor or there's a smoke and there's concern for a fire or some type of emergency, you need to have a plan in place to help these people that have these sensory deficits to make sure that they're not in harm's way. Another thing to consider, I know here at DESA, we deal a lot with transportation and a lot with the energy sector and what have you. I was just participating in a NIOSH conference a few weeks ago. And one thing that you really need to think about is your truck drivers and the long-term fatigue issues. Fatigue is always a concern with that population because of the amount of hours they drive. And we talk about sleep apnea and all those other issues. But really with this post-COVID long hauler symptom, we need to make sure that we're focusing on that population and the fatigue issues that come along with it. So my recommendation is follow the CDC and NIOSH websites on what's the current recommendations out there. They will keep you up to date on what's kind of trending right now and the long-term issues that they're seeing and how they're mitigating some of those. Excuse me. Okay, we're going to shift gears now and talk a little bit about total worker health. Total worker health was a 2011 NIOSH initiative. And the goal of total worker health was, it was an illness prevention effort to advance worker well-being. And that total worker health approach seeks to improve the well-being of not only the workforce and their safety and enhancing the productivity at the workforce, but also going beyond that and how it can benefit the community, the employer, the employee, and the employees' families. Many organizations have signed on as a total worker health affiliate. If you're involved with anything like AAOHN, which I am, the American Association of Occupational Health Nurses, ASSP, National Safety Council, AOHP, they're all organizations that have signed on to this total worker health initiative. But total worker health has been around for 10 years. However, we saw it come to the forefront when the COVID pandemic hit. Companies and organizations not only focused on their employees, but they knew that their employees were doing things well beyond what they had to do in their workday, okay? They had to focus on what was going on with their families as well. These people were learning to work from home. They were homeschooling their children. They were trying to keep that stress environment down. Everybody was cohabitating in the same house. There was, you know, that concern for social isolation. And they may have been caring for ill or family members or worried about themselves getting sick. Lots of stress, lots of issues. So total worker health really came to the forefront as to, excuse me, once again, really came to the forefront on how can we address and what are the magnitude of these concerns for our workers. So a Gallup poll was conducted early on in the pandemic back in April of 2020, looking at working Americans. And this is just kind of a nice synopsis of, you know, talking about, you know, the different things that potentially could affect them. So just to give you some quick statistics on, you know, kind of some of these different areas, 15% of Americans indicated that mental health was already suffering as a result of social distancing practices, and 37% of them expected an even further decline in the coming weeks as the you know, kind of that homebound status and social distancing practices would continue. 9% were already experiencing a financial hardship, and 37% anticipated even more of a hardship in the coming weeks. 6% noted that there was a negative impact on their physical health, and approximately 1/3 of the people reporting indicated that they were doing less exercise and had probably a much worse diet than if they would have been continuing working. So this is a resource. I did a screenshot of the front of this guide. The University of Iowa developed this Total Worker Health COVID-19 guide. You can Google it. It'll come up. If not, I have the link there listed in the presentation when you get sent the slides. But in that, it's a very nice manual, easy to follow, lots of great resources. And you can see there, I listed out on the slide some of the resources directly for you, that if you have been experiencing these within your organizations, how you can address that. Everything from mental health resources to caregiver resources to, you know, ideal ways to work remotely. And, you know, overall, just the workforce and preparing the workforce for this pandemic. Now, as I mentioned, this was in April of 2020. So this is, you know, 1 year ago. But what they did put in this manual, which I thought was really nice, was case studies, real life case studies on organizations and how these organizations dealt with COVID. And what they did was they put this into what they called some best practices within their workplace. And some of those things, you know, obviously cleaning and hygiene was a big issue, but they talked about other things like taking buddy breaks to make sure that you were looking after your coworkers. Maybe you were homebound and they were sending YouTube videos to keep you accountable on wellness activities. You know, here at DISA, we did a lot of things through the homebound and COVID times when our employees were all working from home. We did virtual walks. We dressed our pets up in funny costumes. We had hat days. We had virtual trivia. We did a lot. And I commend our HR and marketing teams for all the creativity and the work that they did, because they tried really hard to keep us socially engaged. And that was really important. Not only did we have to be productive in what we did, but we needed to remain engaged as a team to continue to be productive and meet the needs of, not only our employees, but our customers that we serve. Because trust me, they had lots and lots of questions. Coming into our clinics here, we had lots of questions about, should this person be quarantined? We're not sure what to do. What's considered a high temperature? Should we be doing questionnaires? What are your thoughts on vaccines? Can you offer vaccines? What about testing? So, we really had to keep the stress level down and keep employees engaged. And DISA, I feel, did a really nice job of doing that for our employees. Not to get too detailed and into the research, but this was a really nice research article that was posted last year, which really does a schematic on that integrative approach of total worker health and how this framework is used to really protect not only the essential workers, but the public during the pandemic. So I put this schematic in there and you can take a look at that. It's really nice because it looks at different characteristics. It looks on working conditions to infection control. It talks about the psychological and supportive, demands and, how these collaborative efforts really look at, system efficiencies and as well as worker productivity. So it's a visual for you to think about how this all works together to keep our employees safe. So it's just one example. And up there you can see it's the human factors. It was a journal. Dennerlein was one of the authors. So if you want to take a look at that, again, it kind of gets a little more in the weeds and into the detail of implementing these concepts in this program. So that's total worker health. Now let's talk virtual work. All right, does this look familiar to anybody? All right, how many of us were using our dining room tables for our offices? You want to put in the chat box, you can talk about some of these things. I like to hear what people were doing and what was creative. How many of us had our Zoom calls and our pets walked through the camera? How many of us, asked that question, is the camera on or off for this meeting? Because they wanted to know how to dress and what environment they'd be in or if kids would be in the background. So this is how we worked. Okay, we worked among our kids, we worked among our pets, we worked around our dinner plans, but what we did was we made it work. Put this in for a little bit of humor. DISA had a contest, again, one of those engaging social moments on take a picture of your funny home work environment. Well, Chris Farley is someone that I think is very funny. This picture came to mind because, remember I just said, is the camera on or off for the meeting? That question applied because, you never knew what kind of virtual meeting you were coming into. So anyway, I thought this was funny. I thought I'd share it. This was actually the picture that I shared with the contest here at DISA. So again, many stats out there, depends what stats you're looking for. But there are a lot of ways that we worked. We worked from home. We maybe did some hybrid working where we worked in the office a little and worked from home a little, a lot of different ways. But the bottom line is the stats are telling us about productivity and mental health status of our employees. So if we look at the statistics, here, 75% of remote workers said they felt they were more productive because they had fewer distractions. They attributed, 74% attributed that to fewer interruptions from colleagues. Now, again, I just showed you that picture of pets and children and all of that, but still the statistics show that workers felt they were able to be more productive in that home environment. 73% felt as they were, again, more productive outside of their home and outside their work hours. 40% of workers were willing to take on a greater workload. They had more flexibility in their day. 18% said they would even take a pay cut to have the opportunity to work at home. 49% of remote workers worked between 1 to 5 years in their jobs. 21% worked 6 to 10. 22% have worked for more than 10. So there's something to be said about maybe the comfort level of the resources that they had to work independently versus working in a team environment where you were face-to-face with your colleagues. 24% of remote workers reported feeling happier and more productive at their jobs compared to on-site workers. So again, these are just some of the statistics and snapshots of what's going on out there in the way of remote working. So COVID did change how we work. We had a lot more people working from home, working remotely. We had people that were doing both. You know, they were that hybrid situation where maybe, you know, to keep the workforce low, I worked in the office Monday, Wednesday, and my counterpart worked Tuesday, you know, Thursday, Friday, just to keep the office moving forward, but it minimized the social interaction. And then some people return, you know, right back to the office after the pandemic switch. So this graph that you see here is from a Pew Research report. And in doing the research on virtual work, you know, I ran into lots of comments, you know, about, you know, what company, and I'll talk about this again in a few minutes, but what companies are recognizing now is, hey, there's a huge cost savings, you know, from lessening our expenses from, you know, rent and ownership of a large building, lower utility costs, all the things that go along with a brick and mortar facility. Some companies were taking that and they decided to put that cost savings and reinvest it back into their employees, maybe gave them extra benefits. They increased their salaries. They did something, you know, to enhance their work capabilities. What they found was that employees were happier and they were more productive with this change. So, you know, although there were people that were quite stressed about it, you know, there was a lot of people that were happy about it. Surprisingly here, you know, you see here, you know, with the bottom question on this slide, you know, when they were working from home, you know, if they had some challenges, having the technology and equipment they needed to do their job, you know, 87% said, yeah, it worked, you know, it was pretty easy. 80% also felt that they were able to meet deadlines and complete projects on time. So I think we learned a lot about that. We've learned that 71% up here at the top that we're working from home, 54% now want to keep doing that. A lot of companies are making that an option now, provided you're able to continue to meet the deadlines and do what you need to do. Okay, there's always some challenges that come along with any alternative work environment. You'll see here some of the struggles people reported from working remotely. I'm guilty of the first one, unplugging after work. It is really hard not to pick up that iPhone and look at your email. It's really hard to not, you know, stop the clock at 5 p.m. and go about your day and do something else. So unplugging was hard. You felt guilty walking past your computer and looking at it and thought maybe I better stop and work on that project again. You know, again, I'm guilty of that. Some felt lonely, you know, they needed that social interaction. Collaboration and communication seemed to be an issue. Maybe not so much the act of collaborating, communicating, but how we were doing it, you know, that changed. Home distractions, you know, working with people in different time zones, that's always a challenge. Some people struggle with staying motivated. Some people did not feel the need to take vacation time. They didn't know how to disconnect. And a very, very small percentage had issues with Wi-Fi. Some other things that I found, people really had a hard time with that willpower, sticking to a routine, missing calls because they were doing something else, boredom, you name it. Some people were just anxious because they couldn't get an answer right away and they had no idea how to get that answer. They couldn't walk across the hall and ask their coworkers what to do. So how do we address it? Companies really need to change their mindset on, you know, first off and foremost, we want to keep our employees safe, but we also need to encourage them to set limits and, you know, just like they would at the office. So, you know, some of it's an educational process. We need to learn what to work with what we have. One thing that we did learn is a business continuity plan and effective communication with our employees and customers is key. So that helps on the communication end of things. The other thing is we want to apply policies consistently and fairly. We want to make sure that what we do in a telework environment is the same as what we would do in a bricks and mortar environment. And, you know, obviously that cybersecurity issue, that's always a concern. You know, kind of educating our employees that, you know, probably not the best idea to be accessing, you know, private company business at a local coffee shop. And some of those things that we think that is common knowledge, perhaps we need to obviously keep that in the forefront. And again, we do that a lot here at DISA in educating, you know, customers and employees about cybersecurity and the fallouts that can happen if that is breached. So, who can relate to this picture? Sometimes it's hard. Sometimes it's hard to really convey when you work at home what you do all day. We can laugh at this picture. It's okay to laugh at this picture. There's lots of perceptions out there. Well, you work from home, you work from the couch. So there's a lot to think about this. Maybe your friends are envious that you're working from home and they still have to go to work, or, what's that connotation of what society thinks about home working versus going into an office. So, but I just thought it was a neat way to look at it, because there are lots and lots of perceptions out there. And, it's really hard sometimes when you're trying to do a project and maybe your spouse or your partner walks into the room and asks you for something, and you have to, kindly say, hey, I'm working right now. You need to create those boundaries. So this is a challenge from working at home. So if you want to type in the chat box, I love seeing in the chat box, what were some of the challenges and experiences that you had working from home, if you work from home, or what your employees or people that you worked with, if you have any comments, we'd love to hear from you. Lots of benefits. We talked about some challenges, but lots of benefits. There's many. So when you look out there, some of these statistics that I'm going to share with you now on these benefits are pretty astounding. But, better work-life balance. They talked about working at home and how you can control that work schedule a little bit better. If it means balancing, how you're going to get your kids to school, or, some other obligation that you can have that work-life balance a whole lot better from working from home. Commuter stress. They cite that the average one-way commuting time in the US is 27.1 minutes. That's nearly an hour each day, just getting to and from work. And if you think about that, that adds up very quickly. And we spend about 100 hours, let's just say, commuting possibly a year, more than that. And, these extreme commutes that are 90, minutes one way, and some of you that work in really large areas, like I know us in the Houston area and things like that, you may have a huge commute time just based on wait time. So we're wasting a lot of time that could be done with some way of being productive by, they feel, commuting. So, if we look at the research shows that commuting 10 miles to work each day is associated with health issues. They cited high cholesterol, high blood sugar, increased depression. So if we can cut out some of that commute, they feel more focus can be placed on healthier activities, healthier eating, and not being so rushed to get from point A to point B. We had location independence with working at home. That doesn't necessarily mean you worked at home. I know people that worked from their vacation homes. I know people that decided they wanted to locate to a completely different area to be with family. So we had location independence. And what that does is, if you think about that from a worker standpoint, that location independence puts our nets out further for attracting people to come work for our companies. Perhaps there's good talent in the Northeast part of the country, but let's just say we're based in Houston, instead of coming to Houston, we can use that now because we have people that can work remotely, and we can pull those nets out further to increase the talent that we bring to the table. And they talk about the term digital nomad, and digital nomad meaning that there's really no limit on where we can go to create the work and do the work that we need to do because of that virtual presence. There's, data out there that says there is improved inclusivity. By that, they mean that they feel with working from home, that helps the people that maybe have a disability to be able to create their environment to make it more conducive for them to work. It gives them a more flexible working schedule and environment. So there's thoughts that there is improved inclusivity with telecommuting. Certainly, we talked about the money savings and the financial impact. There's a lot to be had. Just, not from the corporation's perspective, but also from a personal perspective, how much you're saving in wear and tear on your car and gas. It's averaged about $4,000 a year. So that's a huge cost savings. And talks about the fact that you're saving on, different expenditures, even down to stopping at that local coffee shop on the way to work and what that might cost. Companies, as I mentioned, real estate overhead, the utilities, things of that nature. Obviously, there's a cost savings associated for the employer as well. Positive environmental impact. Again, we talked about the water getting clear. We talked about the air getting brighter. There's less cars on the road. There was less, pollution. So there was a positive environmental impact because we did not have all of that extra, environmental issues in the way of heating, lighting, transportation that can, impact our environmental quality. Impact on sustainability. We talked about the fact that we are, getting smarter in how we do work. So sustainability of a company, even sustainability of our employees, they're happier. So if they're happier, they're less likely to want to leave and do something different. So employee retention. We can customize our office, make it as comfortable and as ergonomically correct as we like. Sometimes we can do that a little differently from a home environment than what we can in a traditional work environment. We talked about increased productivity and performance already. Again, employees seem to be happier and, they are feeling that they're meeting those deadlines more efficiently. And I guess I just said it, they're happier, they're healthier, that work-life balance is better. They have more time for eating healthier, physical activity, less exposure to illness. They're creating those environments that they feel is conducive for a good, positive working environment. So these resources here I found were, if you are struggling to find kind of some tools to work at home, maybe, you're a smaller organization and you're not sure where to look, there's, just lots and lots of resources out there to assist with keeping you connected. Zoom, like we're doing right now, is one big one. For video conferencing, we have Microsoft Teams. Lots of, some I didn't even know on this list as I was researching for this presentation. And what I did learn was there was a lot of cool things out there. The one, not to be like a big brother, but, there was one down there, the last one, bonus work from home tools. There's a tool called Time Doctor, and Time Doctor monitors our app and software use. If, it can be used, sadly, as a punitive measure if you want to look at productivity and there's a concern with someone doing productivity. But it's also a good time management skill person and tool for you to kind of revisit on how you're spending your day. So I thought that was kind of cool, called Time Doctor. And, there's things out there to help with workflow management and make you streamline your processes to do things better and more efficiently. So if there's any tools that you have used, in your practices and you want to share with the group, you can certainly put it in the chat box. We'd love to hear from you and talk about what those tools are, because we learn from each other and we learn what works well for, us. May not always work well for you, but there might be an adaptation that it can work well for you. So best practices from home. I'll just run down the list here. This is, again, taking that total worker health approach and thinking about, how can you remain happy, healthy, and productive, at home. You want to maintain a regular schedule, just like you would at the office. If you work 8 to 5, that's the schedule you want to keep at home. You want to create that routine. So if it means, getting up, making your coffee, and getting fully dressed to sit in your dining room at the table to do your job, that's still your routine. You want to keep to that. You want to set ground rules for the people in your workspace. So make sure your kids and your spouses, significant others all know what your workspace is, when you're in it, and what you have to do is important. You schedule yourself breaks, get up, walk around, walk outside, take time just to kind of clear your head, get away from that work environment. You want to, if you have to leave home, I can tell you, I took a walk around the block many a times, 1, to clear my head, 2, just to get outside. But it was just a way for me to re-energize and kind of get things back together, to get back at sitting at that dining room table and doing some work. If you need help, ask. Make sure you ask and tell your employers what you need. Having that dedicated workspace is helpful. It makes you more productive, just like you do at work. You know, a traditional job, you know, have that stapler handy, have, you know, whatever you need, make that work environment conducive for you. If you want to have a separate phone number, that's advised. A lot of times companies will just, you know, forward your phone number that you had in the brick and mortar facility, but you can set up your own separate phone number. That way people are not calling your personal phone as well as you're using it as your work phone. So you can set that up. Use a VPN, I think for obvious reasons, for security. You want to continue socializing with your colleagues. That's important. Whether you do that in virtual events, now we can get back to face-to-face. That's still important to do that. Schedule those times to be together. When you show up, you want to be present. You know, I think it's a good rule of thumb to have that camera on, ready to go. It's very easy to be tagging off and doing something else. If you're sitting in front of that camera, you're dressed and prepared. You are prepared for that meeting. Plus, it makes you in that mindset. You're going to be more productive. You want to still get FaceTime with all the important people that you need to be involved with. Keep your team involved, and, you know, work with your boss, work with your colleagues, but FaceTime is still important. If you're feeling ill, it's okay to take sick days. People still get sick, even when we work at home. You may not be on your game that day and you're not feeling well. It's okay to take those sick days. You want to continually look for opportunities that you need to better yourself for training and learning purposes. They may come to you, they being your organization. You may need to come to them and say, I need more assistance and this is what I need. Don't feel that you can over communicate. Communication is always an issue, whether you're working side by side or not. So over communicating is not a problem. Remain positive, be positive, and if there's something that you do not agree with, it's okay to disagree, but have it in a forum that's respectable to that discussion. Take advantage of the perks as people are doing these virtual events, and there's a lot of like mobile apps and stuff that are out there for wellness and mindfulness and all of that. Take advantage of what's out there. There's more and more things being offered now, free mostly, for, you know, whatever issue that you might have or concern. Don't be too hard on yourself. Again, set those boundaries. It's okay to walk away from your job. It's okay to say, I'm done working for today. Don't be too hard on yourself that you feel you need to, and I need to practice what I preach. I will say that. Having those boundaries and setting them. And end your day with a routine. If you do that at work, that's important to do that. So my last slide, 2021 and beyond. You know, what we're seeing now, this is kind of where the future is heading, or what's being predicted out there right now. There's an increased health and safety investment. Companies have to do it. They have always been doing it, you know, because of OSHA and the other regulatory guidelines that are out there. But now more than ever, there's an increase, you know, kind of focus on health and safety investment. We are looking at things like preventative health, telehealth, increased compliance. There's just a ton of new things out there, new PPE. There's just so many things that are out there, and that's considered going to be in the forefront, obviously, going into the next year. There's a term called predictive analytics, and safety professionals are going to be using that more and more. Predictive analytics or predictive analysis provides us insight on if X happens, then Y is also likely to happen. So we are predicting, it's almost like, you know, artificial intelligence or AI in medicine. If we're predicting something, we're going to now know what to predict when and how to address that outcome. So we're going to see more of predictive analytics. We're going to see a renewed focus on total worker health and safety. That's why I talked about that in today's slide. I think it's really important not to think just about the worker, but to think about the worker, their families, their communities. Think about things like mental health issues. That's a huge issue right now for everybody, for all those reasons that we just talked about in the last hour. We want to cater to organizational knowledge loss. Right now, unemployment issues are a problem everywhere. There's issues with retraining. There's issues with knowledge loss because, you know, someone retired or left work and they didn't have the ability to cross train that person because they were out on, home status because of COVID. So there's a lot of issue on knowledge loss and how are we going to address that in the future. So now is a really good time to look at how to create and develop knowledge sharing programs and reinvigorating some of these old ideas that we had with OSHA and invest again more into safety. We are going to focus more on safety in the next decade. Again, I think we've learned a lot in the last 18 months, at least in healthcare for sure, we've learned a lot, but to know exactly what is coming down the pike and how we can foresee, PPE shortages and things of that nature. I think we're going to see lots of telehealth. I think we're going to see more of health equity and how we can address some of those barriers. We need more behavioral health services, whether that be through a telehealth scenario or, some type of mobile app. Companies are investing in purchasing licenses for things such as, Fitbits. Virgin Pulse is one we use here at DISA. There's a lot of things that they're doing to help really get the worker involved in their health and safety. We're looking at hybrid workplaces. That's going to continue to be an issue, or just the good old working from home. So we need to think about those policies. We need to think about retraining and reskilling and that knowledge sharing, as I just mentioned. We need to look at our workers and their workspaces to keep, health and safety and their security all in check. And technology is our way of the future. Again, mobile health, wellness, mental health, so many things out there. Be open to that. Keep that in front of your employees. There's no age barrier to knowing technology and using technology. And I would strongly encourage, getting some training exercises out there so they're not fearful of this. Many of them got a crash course in telemedicine because they had to. But, we can plan that now and be a little more predictive, I guess, going forward. So I think I have maybe just a few minutes for questions. I thank you so very much for your time this afternoon. And I'm going to turn it back to Mackenzie to see if we have any questions.
Thank you so much, Kim. Yes, so this brings us to the Q&A of today's portion, or Q&A portion of today's presentation. It looks like we do have time for just a few questions. And just a reminder, if you submitted a question that we aren't able to get to, we will follow up with you following the webinar. So Kim, our first question is the COVID vaccination status HIPAA protected?
That's a great question. And that's really a hot topic right now too, because there's a lot of discussion about universities and organizations asking for documentation on vaccine status. So it is considered personal health information. However, HIPAA does not apply if your employer is not a covered entity. So if you are a university or you are an employer or a customer asking for vaccine status, HIPAA does not apply. So unless you are a healthcare institution, like, here in our clinic at DISA, and someone would ask if, and we're not providing vaccine, but if we were providing vaccine, obviously that would be protected information I could not share with somebody else without the employee or the patient's permission. But universities can request it, organizations can request it. And according to the ADA, that was another thing that I found in the research was you cannot refuse services to customers that will not provide vaccine status. So that is an ADA protected, but it is not HIPAA protected unless you are a HIPAA protected entity.
Okay, thank you so much, Kim. And then another question, do you feel that companies, universities, and schools should require students and staff to be vaccinated?
That's another really good question. I was just asked that question just last week. I'm involved with a local university here in Pennsylvania, a state university, and the question came up, what's your opinion on requiring vaccine for all these people. And, you know, I guess the occupational health nurse in me says, I would like to say yes, I'd like to see everybody get it, but in practicality, there's a lot of people out there that still are anti-vaxxers for, you know, some of the childhood diseases like measles and what have you. So I think it is a personal choice. I definitely think it's a personal choice. But at the end of the day, I think it's my job as an occupational health nurse that we do informed decision making, and we give the best information that we can to support why we feel it's a good idea. And ultimately, the consumer is going to have to make the decision. But the CDC and those sites are the best places to go to get that information.
Okay, thank you so much. And I think we have one more question,
Okay.
or have time for one more question. If I have an employee that has questions about the vaccine, is wondering where they can receive the vaccine, where should I send them to?
All right. Well, certainly the media does a really good job. I know locally here in Pennsylvania, they're constantly announcing where the public is available to have, you know, they're offering the vaccine. First and foremost, I'd recommend if you have, you know, a personal care physician, a PCP, I would recommend talking to them first. They will tell you what's available and work with you to get it scheduled. If you're working through like a community agency, like your Department of Health or something like that, they can tell you where it's going to be offered within the community, and you know, kind of guide you to what's, you know, if there's transportation issues or anything like that, they can help you with that issue as well. But working with your local healthcare institutions or your healthcare plans is really the best way to find out, you know, where these clinics are going to be held and how they can do it. And some of them are even offering to come to, you know, big employers and organizations to make it more convenient for your employees. So you can ask that question as well.
Awesome. Well, thank you so much, Kim. Thank you to everybody who's joined us today. We will, just a reminder, the slides and presentation will be available soon. It will be emailed to all of our attendees today. And if you have any questions, feel free to reach out to Kim. I believe her email address is there on the screen. And thank you so much for joining us today.
Thank you all. Have a great day.